going to get started. How's everybody doing? All right. Happy Friday. Thanks for joining us. For those that don't know me, my name is Gregorio Montezel. I'm the Associate Director for Diversity and Community Affairs at Mountain Park. Quick question, Diversity Dialogue, by a show of hands, who's attending a Diversity Dialogue for the first time today? All right. Well, thanks for coming, first timers. So I'll start off with a little bit about why we do these dialogues, then get into a little bit about the Arizona Housing Coalition and the topic for today. So as a department, we're always looking at really kind of what are the challenges and the needs of our most kind of marginalized, vulnerable patient groups. So we're interested in kind of talking about the broader factors that impact the health of our patients, right? And so these diversity dialogues are meant to kind of create a space, have some food together, learn from some external partners of ours that can educate us about the issue at hand, and then hear from everyone in the room about what your experience has been kind of addressing this need for our patients, maybe some ideas about what we could be doing differently going forward to address that challenge for our patients. So hopefully, you know, they used to be called Diversity Lunch and Learns, now they're Diversity Dialogues because we want it to be a conversation. So we invite your questions, your insight throughout, right? So that's a little bit about why we do these. And if you have any suggestions for other topics, we're always open to kind of exploring other ones for future dialogues at other clinics. So with that out of the way, a little bit about how we got to today's topic. Again, it's something that I think just broadly as a department, we're aware in Phoenix that, you know, things like rent prices are continuing to increase. The rates of eviction are something that are increasing as well. And just the numbers of homelessness continue to increase. And so we want to, you know, kind of put a spotlight on that challenge. And we know that, you know, many of our patients being, you know, underserved communities, low-income families, things like that impact them even at a greater rate. And so what role do we have as a community health center that provide health care to these families to kind of just be more aware of that challenge, try to provide support and assistance in a kind of more effective way in the future. So that's really kind of how we thought this was a topic worthy of kind of everyone's time. And we have some, you know, a great partner in the Arizona Housing Coalition, relatively new partner, getting to know more about their work, to kind of share what they do with us today. I know there's several things. Let me kind of go down the list here of kind of what the Arizona Housing Coalition, their mission again is it's a collaborative association that leads efforts to end homelessness and advocate for safe, affordable homes for all Arizonans. Got that at the website, so I'm pretty sure that's exactly the mission. Some of the things that they do, they provide education, training, and networking opportunities for membership organizations. They advocate for funding priorities that will end homelessness and housing instability. And they also collaborate with partners to increase the supply of affordable homes and build capacity of service providers and homelessness. So I feel like, you know, there's some things that we could stand to learn from the work that you all do and kind of just look at what we're currently doing at Mountain Park in these areas. So with that, I'm going to welcome up Joan Serviss and Joanna Sega up to the room. Let's give them a hand.
Thank you guys. Can you guys hear me okay? Yeah. Okay, great. Let's see here. So, you know, as I mentioned, we're the Arizona Housing Coalition, but we are, we're a result of a merger. We are a merger between the Arizona Coalition to End Homelessness and the Arizona Housing Alliance. Because obviously, how do you end homelessness? Provide homes. But it's not that simple. When we talk about things that let's see, right?
I'm going to click down. I can assist as well.
I'm doing something. Okay. Showing.
There you go.
Here, so we already talked about what our mission statement is. But as we talk about ending homelessness, I think it's really important, and I do want this to be a dialogue, but from time to time I'm refer to my notes because, you know, sometimes it's my little cheat sheet. As we talk about ending homelessness, I think it's helpful to have kind of a baseline understanding of the problem statement. And we, as a community of homeless service providers, we use what's called a point-in-time street and shelter count that is done every year, every January, where we go out and identify how many folks are living on the streets or in the shelters, and we actually provide that information to HUD, the housing, part of the Housing Urban Development, and that's what they base each community's distribution of federal funds to address housing and homelessness. This number is neither precise nor perfect. I mean, I think there's a lot of debate about it, but it is a snapshot in time. The reason why I say it's neither precise nor perfect, but something that we use as a community is because it, the volunteers that go out onto the streets, they're identifying folks, and they're actually, back in the day, we used to just ID folks, like, oh, okay, you're homeless, you're not homeless, you're just a teenager that wears, baggy clothes, maybe you're not, just kind of really, that discrepancy between the volunteer saying, like, is that somebody who's homeless, or is that just a teenager who just likes to wear kind of baggy clothes? That was, really subject to interpretation. So now we engage folks who are living on the streets, ask them what caused their homelessness, and we try and figure out what resources we can provide to them right then and there. But what it doesn't take into account is a lot of the families who are experiencing homelessness. Because obviously if you're a family living in a car or living with other family members, you're not captured in this count. And that really creates a problem because that's actually one of the fastest growing subpopulations of folks experiencing homelessness is families. But they obviously don't want to be engaged. They don't want to be counted. They don't want to be engaged because there's fear of losing their child, losing their children. So this is a national figure. We have over 500,000 individuals experiencing homelessness. In Arizona, here we go. And now this is for Maricopa County, and we do have the numbers for 2018 for Arizona, and that's about a little less than 10,000 individuals across the state of Arizona are experiencing homelessness. In Maricopa County, obviously one of the fastest growing counties in the nation, we've seen a 202% increase of unsheltered population since 2014. 202% increase of folks who are living out on the streets, not in the shelters. So in Maricopa County, in January of 2019, volunteers and experts went out into the streets, into the shelters, and identified that there were 6,614 individuals experiencing homelessness. So really what it shows is that there's, and we'll talk a little bit more about this, but the causes leading up to homelessness are really diverse and complex. The reality is, whether it's because of substance abuse or domestic violence, the reality is that these individuals lack a stable, safe place to call home. And we find that unacceptable. Poverty, domestic violence, obviously are contributing factors. Affordable housing is really the scarcity in our community. So that leads us to the conversation of housing and health, because I know that that's something that Mountain Park Health Center really wants to focus in on, is that connection between housing and health. I know you guys are all familiar with Viola's wheel, what is it called? The social determinants of health wheel. We at the Housing Coalition really respect and understand. I think that's a really great a really great diagram to show the interconnectedness of all these different pieces of the pie. Housing is where we find our, we know that this is our lane, we really focus on housing, but we also see the connection between all the other pieces of that pie. And housing really does affect health. There are three important and interrelated aspects of residential housing and the links to health. It's the physical condition within the home, conditions in the neighborhood surrounding the home, and then housing affordability, which affects neighborhood choice, neighborhood conditions, and affects the overall ability for families to make healthy choices. So when we talk about physical conditions of home, think about this. This is actually, whenever I get to this diagram, I always think about Secretary Ben Carson. He's the Secretary of Housing and Urban Development. He's really focused in on some weird things. But the one thing that he's really concerned around is the mold condition in homes and in public housing programs. So good health really depends on homes that are safe and free from some of the physical hazards. We look at, like, for example, locations like this, the top picture. That is not a place that what we in the kind of service provider industry as community say that's not safe for human habitation. If there's no running water or access to heater or air conditioning, especially in Arizona, that's necessary. So it's not fit for human habitation. So you think about asthma, lung cancer, and other respiratory illnesses that can be caused by substandard conditions. And then obviously exposure. I think we all, did you guys see that in the news? I didn't read it all, but there was a woman who was about $30 shy on her APS bill. So you all are, yeah, so you see that connection. Poor indoor air quality, lead paint, that's another thing that Secretary Carson was concerned about, lead paint. I hate those lead paint shirts, I think I'm fine. Lack of home safety devices and other housing hazards can really exist in the home, placing families and children at risk. And the families with fewer financial resources are more likely to experience unhealthy and unsafe housing conditions and are typically least able to remedy them, contributing to disparities in health across social economic groups. Obviously, it goes without saying. All right, neighborhood conditions. So we think about neighborhood conditions, transportation, safety, access to healthy foods. We've all heard about food deserts and the role that plays in contributing to the overall health and safety of the human or the family. The neighborhood physical characteristics help promote the health by providing safe places for children to play and for adults to exercise that are free from crime, violence, and pollution. Access to grocery stores that sell fresh produce are important, as well as having fewer neighborhood liquor and convenience stores and fast food outlets. It makes it easier for families to choose and make healthier decisions. We actually, the Arizona, at the time it was the Arizona Coalition Against Homelessness, we were asked to take, to weigh in on legislation for, there was a conversation about using your EBT card using that at Jack in the Box. Now, we obviously, absent all of the knowing that we oftentimes, many of the folks that use EBT cards, they're on food stamps, they don't have access to safe and affordable and healthy food choices. So absent that, we would advocate that they be okay with using their EBT card at Jack in the Box. But we need to make sure that there's access, and I know that the Association of Arizona Food Banks has done a great job of connecting the food stamps to like some of the farmers markets. So again, there's that, there's a really significant increase in connecting folks to making good healthy food choices. Let's see here. Not all neighborhoods enjoy opportunities and resources like access to healthy foods and transportation. Housing discrimination has really limited the ability of many low-income and minority families to move to healthy neighborhoods. This concentration of substandard housing in less advantaged neighborhoods further compounds this racial housing discrimination. Housing affordability and insecurity. As was discussed, eviction is really kind of the hot topic in Arizona nowadays. The affordability of housing has clear implications for health. The shortage of affordable housing limits families and individuals' choices around where they live, often relegating lower income families to substandard housing in unsafe, overcrowded neighborhoods with higher rates of poverty and fewer resources. The financial burden of unaffordable housing can prevent families from meeting other basic needs like health care and nutrition. So this is something that was just released, it was Tuesday of this week, from the National Low-Income Housing Coalition. It is a report that we put out in conjunction with that national group, And it reveals that for Arizona, you have to make $19.52 an hour. That's considered the hourly housing wage that somebody needs to make to afford a modest 2-bedroom apartment in the state of Arizona. And that's for the state of Arizona. I'll point out that Flagstaff up north, they have a significantly higher housing wage because it's so expensive in Flagstaff to live. They're landlocked, it's a college town. Yeah, they're really struggling. And they've actually tried to pass some bonds unsuccessfully to alleviate some of that housing burden. But, you know, $19.52, that's so that you're not spending more than 30% of your income on housing. This report really shows that because of the housing costs, housing is out of reach for low-income families, folks on fixed incomes, and other low-income households. This report also indicated that for a minimum wage worker, we know that minimum wage is set at $11 an hour. If you want to afford a 2-bedroom apartment in the state of Arizona, you need to be working 71 hours a week. 71 hours a week. Can you imagine that? If you're a single parent raising your children and you want to afford a 2-bedroom apartment, you need to be working 71 hours. So where's the stability for that family? In no state across the nation, even those states that have increased their minimum wage, can you afford, or can a minimum wage renter working 40+ hours afford a modest 2-bedroom rental unit? So we really have an affordable housing crisis on that. All right, so we are, how the Housing Coalition does a lot of our activities is around advocacy. And there's some recent proposals at the federal level that I wanted to bring to your attention. And I do have with me, I forgot to bring them out, but I do have with me postcards, if you guys want to take action and fill them out, and I'll leave them, and I'll collect them. Sydney, can I? So Sydney used to work with the Housing Coalition, so she's or Gary, if you can help collect all the stuff, we'll mail it, so because it doesn't actually have a place for mailing it. But what the proposals are, and again, from HUD, there's a proposal that would impact mixed status families. I see some people shaking their heads. So it gets a little complicated, so I'm going to say it use an example. So a family of 4. The rule that is being proposed is that a family of 4 where there are the 2 children are American citizens and the 2 parents are not, this family of 4, because they have mixed status, they would not be eligible for housing assistance or for public housing. So that's the proposal that's being proposed. And so that in that example, the 2 kids are eligible, the 2 parents are not eligible. Currently, and the thought is like we don't, HUD or the base of the administration might be saying, well, we don't want housing assistance, our taxpayer dollars to go to people who are not assisted. Well, the reality is that it doesn't. So in a family of 4, the children are eligible for housing assistance, but the parents are not. That housing assistance for that family of 4 is prorated to just provide housing assistance to the parents, or to the children, not even to the parents, right? And so under this proposal, the whole family would be evicted. Or they would, the family could decide to not pursue any more housing assistance, but we already talked about the housing, how expensive it is to maintain affordable housing. So the proposal is that, and the proposal is also saying, well, the reason why we're doing this is because we want to have the folks on the waiting list who are all 4 family members in that example can be eligible for housing assistance. But that's going to be more costly, right? Because the assistance was prorated, now it's going to be the full family of 4 that are eligible. And this coming from an administration that has consistently proposed cuts to federal housing assistance. I don't see that happening. So in HUD's own kind of write-up of how they would implement this, there's some HUD administrative systems level folks that are saying, this is not feasible, this is not doable. So we're echoing that concern, and we ask folks to submit comments. They're accepting public comments. We've kind of created a kind of sample script for you, just provide your own information. Again, we'll collect these in the mail. The other thing that HUD is trying to do, or that HUD is proposing to do, and I'm gonna refer to my notes because I don't wanna say this wrong. So the second proposal would reduce protections under the Equal Access Rule for LGBTQ youth and adults seeking emergency services from HUD-funded programs. Under this proposed change, homeless service providers that receive federal funding, so receiving taxpayer assistance, can take privacy, safety concerns, practical concerns, and religious beliefs into consideration when determining who receives services. So it weakens some of the protections that exist for folks who, ultimately, you don't want to have to, if you're in a crisis and you want a safe place to stay for the night, you don't want to have to be turned away, especially when it's a program that receives taxpayer funding. Now, we know that there are some homeless service providers that don't take federal funding, and they might have some requirements and stipulations, and they might, kind of really categorize or focus their services on folks who have a certain religious affiliation or kind of adhere to their beliefs or what have you. But this, if you're receiving federal funding, everyone should be eligible for that service. So we're saying, don't do that. So it's another postcard opportunity to strengthen, not weaken, the equal access rule. I want to go back and say that under the mixed status family proposal, again, according to HUD, it would impact and displace 55,000 children across the nation. In Arizona, we've been in contact with the public housing authorities that administer a lot of the Section 8 voucher programs and public housing programs. They estimate it's going to have about 1,000 family impact across the state. So I hate to play like the weak, telling kind of bad stuff, right? Like there's a lot of negative stuff. I will say on the one kind of bright spot is that there's been a lot of attention to the affordable housing and homelessness issue, the increase in some of the figures across the nation. We've seen some really bold proposals by some of our presidential candidates, Cory Booker, Kamala Harris, Elizabeth Warren. They've all put out some really strong and bold proposals that if they were elected, that would really shine the light on affordable housing and homelessness. So again, we don't know, what we can't kind of read the tea leaves on that conversation, but ultimately for us as housing advocates, we're really appreciative of the conversation being generated and started. It used to be like I make visits to some of our elected officials, and the staff members would kind of look at me and say, HUD, continuing repair funding, Pinto funding, what is that all about? Now they all know about it. They're all, because it's no longer affecting just low-income families, it's affecting us all. Housing is affecting us all, the cost of housing is all. At a state level, this is where we spend a lot of our time and energy, is really trying to increase the investment at the state level to address housing and homelessness. In the state of Arizona, again, we're the fastest growing county in that state, only $5 million from the state comes to address housing and homelessness. That's so little, especially when you think about Massachusetts, that spends $40 million. California, they've had a lot of focus on some voter-approved measures, and some elected officials are kind of really getting in front of the housing and homelessness conversation. Even with those voter-approved measures, though, and a lot of funding going to California, their numbers of homelessness is on the rise as well. So we have been advocating, let's make sure that the state is paying their fair share so we don't end up like California, right? But if you look at Colorado, they're being really mindful with their state funding. They're passing a state affordable housing tax credit, something that we've been advocating for. They're passing a state housing trust fund. We have a state housing trust fund. This isn't something that the Housing Coalition has been instrumental in trying to advocate for, but this is, and I don't want to kind of get too far in the weeds, but at one point it was $40 million, now it's $2.5 million. It used to be that how it's funded is if you were to pass away, so I'm going to pick on Joanna, I feel like I'm picking on everybody else, I'm going to pick on you, Joanna. If you were to pass away without a will, any property, savings bonds, whatever, the state can sell and a portion of that would go to the State Housing Trust Fund. At its heyday, it was about $40 million, but with the Great Recession, it was capped at $2.5 million. But we're almost 10 years from the Great Recession, and yet we're still looking to restore this funding that was taken from us. This past legislative session, we were able to get a one-time investment from elected officials of $15 million. So yay, congratulations, I'm so excited about that. In fact, right after I leave here, I'm gonna go to the Department of Housing and talk to them about how they're gonna spend that money. But it's one time. And housing crisis, it's not a one-time thing. A lot of folks are dealing with housing crisis ongoing. I do think that kind of one-time investment was really helped and kind of spearheaded or really helped by the Arizona Republic and Arizona Central. They've done a great job in the last few months of shining the light on the crisis. Alden Woods, Catherine Rieger, they've really been talking a lot about evictions. That's been great. We focus in on policies that impact access to healthcare, livable wage, and affordable housing. I always say that there's kind of it's very broad, but there's a stool of ending homelessness. How do you get out of homelessness? You need to have a livable wage, you need to have affordable housing, and you need to have access to healthcare. Evictions, it's really bad, but it's all a byproduct of the fact that we have a lack of affordable housing. And on a local level, the Housing Coalition, specifically Joanna, has been focusing in on some of the best practices and toolkits to help our locally elected officials and local administrators on how to implement good policy, how to address zoning issues, because affordable housing is very much a zoning issue. And then how do you combat NIMBYism? Not in my backyard. So that's what we've been focusing on in terms of advocacy.
Can I ask a
Please.
question? You've been talking for a while, so I'll give you a break.
Yeah.
So the numbers are not surprising, but every time I think you see the numbers of folks who are homeless versus housed in shelters or otherwise, it's just it's heartbreaking. And as you mentioned, it's the fastest growing county in the country. And we've known that it's not happened overnight. It's been a slow rise, and we see a lot of folks being displaced as a result of the prices of housing going up. So we're a healthcare organization. Over the last couple of years, we've done a lot more advocacy than we've ever done before around broad issues that impact health, whether they're direct or indirect, right? And so for organizations like ours, either on the policy side, or we've been having a lot of internal conversation about livable wage and what that means and easing financial burdens for our employees. But are you seeing, in a perfect world, right? How would you see a Mountain Park, or what have you seen other healthcare organizations really do to impact this larger issue of housing as it relates to health?
Thank you, that's a great question. In fact, we were really trying to be deliberate with making the connection between housing and healthcare. We brought on Brandon Clark from Circle City, although he left to go to Quality Health. But ultimately, the reason why, not to pick on Brandon, but the reason why we wanted that connection, and we'd love to explore the conversation for the future, is that we're all singing from the same chorus, right? We're all talking about cost efficiency. When we talk about healthcare and the services you provide your clients, you're talking about being the most efficient with the limited resources we have available. It's the same thing for the housing world. So how can we echo each other and sing from the same chorus? Maybe that's a good analogy. How can we? But I think one of the things where I think there's opportunities for shared learning is talking about the funding streams and the acronyms, right? Like, we live in this world of nonprofits, we live and die in the world of acronyms. So how can we almost crosswalk each other's vocabulary and then use that as the chorus to legislators to say, this is a financial decision that's good for the taxpayer, that's good for your base, that's good for your electoral base. I mean, that's how I could see there would be a great interplay. We put on an annual conference, and so we're always seeking breakout sessions, and if there's a way to recruit from you all some breakout sessions, just talk about that connection between housing and healthcare. That'd be some other ideas that come to mind.
Thank you.
Any other questions? All right, well, I'm gonna put Joanna on the spot because she's gonna pull off her Housing Coalition hat and put on her old hat from when she was in the direct service field. And kind of, because I know that a lot of times you guys are connecting with families, trying to connect them with whatever resource that's available. I wanna kind of put a caveat before Joanna talks and say, this system, as you all know, is neither precise nor perfect. There's gaps. There's numbers you call at 5 o'clock on Friday and you're gonna get a busy signal or no one answers, and it's frustrating. Like, we're all dealing with limited resources, so I'm just gonna caution everybody and like just kind of pre-warn that as long as you have, like, we wanna arm you with information of how to connect and provide resources to your families and individuals, but it's not perfect, but we're trying to make it. We're trying to strengthen it. So, Joanna.
Thank you. So yeah, I used to work for UMOM, which is family shelter and housing services down in Van Buren, Phoenix, and they help families and single women also. And so I had the opportunity to be trained in the coordinated entry system. So I want to explain what coordinated entry is. So Maricopa County operates under coordinated entry, which is, what that means is that there's a single point of access for any individual or family who is homeless or at imminent risk of homelessness. So that's homeless within the next 2 weeks. And if a person is in that situation, they can go to one of these single points of entry and be assessed for services. And the idea is that it kind of alleviates the crisis. Before coordinated entry, what families and individuals had to do was to call around individual shelters and housing services and just kind of get stuck in circles and not quite knowing where to go. And so the coordinated entry system has required these services to build connections with all the shelters and the housing services to have the knowledge of the eligibility systems and the various programs available so that when a person is in that situation and they're trying to find help, they can be referred out to the appropriate resource. So these are the entry points in Maricopa County. And I'm just going to go through them all. They're kind of divided into areas, but also populations also. And this is the single side. There's going to be a different slide for families. And so you're looking at, with the populations, veterans, youth, and then single adults and couples. So in the Phoenix area, the Welcome Center at the top there, they're connected to CAS, which is the Central Arizona Shelter System downtown Phoenix. So that's the main campus. I don't know if any of you have ever been down there. But if you have single adults or couples without children who are not veterans, then that's where you would direct them. PYRC is the youth service, so that's operated by UMOM, and that's for 18 to 24. Yeah, 18 to 24. So they have a separate site specifically targeted towards youth. And then the CRRC is the VA Resource Center. That's again Central Phoenix area. Any veteran that you come across with really needs to gain access to the CRRC. I mean, they can access the other coordinated entry points, but because services for veterans, there's more of them, there's more funding, it's a little more specified, and so even if they want to go to the Welcome Center, at some point they'll be transported to the CRRC, so that's really the specialized entry point for veterans. And then we have the East Valley, so Casa Cristo, that's like a community center kind of outreach point for homeless individuals out in Mesa. And they do some really cool things like food, clothing, access to employment, but they can also assess for services. So it means that anyone out in Mesa and the East Valley doesn't necessarily have to travel down to the other areas. A new leaf is the East Valley Men's Center. So that's an actual shelter for single males, and they can do the assessment there. here, it gets a little confusing because it just has the numbers, but the top one there, the Phoenix, is the Halle Center. The Halle Center is a shelter for women attached to UMOM. It's I've been down there a few times. It's probably one of the nicest women's shelters I've seen. It's a really nice place. If you have any homeless females, that's a really good place for them to be to get the services. And then the other two, so that's iHelp. iHelp have a number of shelter services for single men and women. And then the East Valley number there, that one is a new leaf for women. So it can be attached to a new leaf there. And then on the right here, these are the outreach services. So these really are targeted to individuals that are already sleeping on the streets. So outreach teams will go out to locations where homeless individuals are reported to be staying, and they can do assessments there and connect with services. Community bridges at the top there, they have really specialized services. So often if you have higher acuity patients, so somebody who maybe have higher needs, more vulnerability, maybe struggling with substance misuse or mental health, community bridges perhaps is a little more targeted towards those more vulnerable populations. And then just to explain what happens at these services, so if an individual or family was to attend, when I got to family yet, was to attend these services, then assessment would be made to identify the housing situation. So normally what should happen is a conversation initially just to see what is going on and to see what resources that individual can be connected to solve their immediate crisis. And if that crisis can't be resolved, then we can be assessed for shelters and housing programs. So there's various housing programs such as rapid rehousing, where individuals are connected to housing as quickly as possible and supports put in place to get them self-sufficient, or permanent supportive housing programs if there's a longer term need. I will be honest that, as Joan said, it's not perfect and there's incredibly high demand. So one thing that should never be communicated is that these centers will be able to provide housing straight away. Like it's just not realistic. Oftentimes there's going to be lists. I'd say that veterans can be served quicker because there's more programs and services, but it's unfortunately the reality that people need to get down to these services if they are homeless or within 2 weeks of becoming homeless to get assessed and get on these lists. But really, if there's other resources that can be used to kind of divert away from that situation, there's honest conversations really have to be had about the state of services right now here. And then just to explain the family side. So for families, it's exactly the same process, but down at UMOM Family Housing Club. So they operate in their main location down on Van Buren, but they also have centres in the East Valley and the West Valley, and it's exactly the same process of having the assessment and the conversations in connection to resources. If you come across any patients that may not be homeless or at imminent risk, but may just need connection to some resource like one-time assistance, I'll be honest that services and financial assistance may exist, but it's very hard to come by. So there may be faith-based organizations or local CAP offices that may be able to pay rent to avoid eviction, or maybe able to help with a deposit or a utility bill. It's definitely not guaranteed, and it is hard work. I have printed off, and I definitely did print it off, an emergency assistance flyer, and it lists emergency assistance for a number of things, including food banks, utility assistance, rent payments, deposits. I will send the list to you to email, like patient that is needing housing resources but isn't quite at this point where they need this assistance, then that list, I think, is the most comprehensive that I've come across. So you're welcome to provide that. And that's everything that I have. Does anyone have any questions about resources or services assisting caring units?
What's the process beyond, once they go to the family housing hub? How do they do this, that? From that point forward, I know it's, last I heard it was 46 week until you get placed in a shelter. What's the process that it gets designated, I mean, obviously based on the category in there, is it the shelters that contact the family housing hub, or is it the vice versa, or?
Yeah, so what happens is once that family have been assessed for and determined for the need for shelter, a referral is sent out from the family housing hub to the shelters. But once a space becomes available, that shelter will contact that individual. So in the meantime, I think you're correct. Right now, I think the family housing hub reports to me a 5-week waiting list. And each week, the family have to call in to stay on the list. So there's a call-in number where they leave a message. And that's a really important piece that is communicated to families, and they are given a phone number. And I think that again can be a problem, because sometimes when families are homeless, they lose their phone, their phone gets shut off. So that can be a problem. But I guess the family housing hub are just trying to do the best to sort of figure out who still needs shelter. But with the housing programs as well, sometimes housing programs come available before a shelter space. So I guess there's two different types of housing services: the emergency, which is the shelter, and then there's a longer term, which is your rapid rehousing and permanent supportive. So oftentimes families will be put on the list for shelter and say rapid rehousing. Sometimes it might be the case that rapid rehousing comes around first, so they may get a call from them before the shelter.
And I think, just again, equipping yourselves with all this information, I think is oftentimes, as Joan mentioned, these individuals or families don't have, a continuing cell phone. They may just come on and off, right? But you guys, as their, almost, you can act as a client navigator to help them and support them get connected to services. I often get asked, well, what do I do as an individual? What do I do when I engage somebody or I see somebody off the freeway or in the downtown Phoenix area? There's a whole conversation about should I give them money? I don't want to have that conversation. But what you can do is ultimately this is why we say they're experiencing homelessness. They are an individual, so you guys know this, right? Like, you know all about like engaging with folks. They're an individual, so if you can walk alongside them and build that trust so that you can connect them to services and stand with them, because you know that they're going to experience the same kind of runaround that you all might, right? I often hear like, oh, well, they wanna be homeless, but we can't help them. No, the reality is that they hit bureaucracy. Bureaucracy exists for all of us. So how can you support them and say, no, don't give up, keep trying, keep making that phone call. So that's what we'd love to, again, provide you the information, but also help support you in walking alongside them.
So to that point, and the topic of communication, of continuing communication, it seems that there are a myriad of points that we as non-professionals may not consider, such as communication, establishing communication, how to approach and walk alongside. Is there a centralized training or a resource for us as individuals that we can look to kind of guide us through that process of assistance?
I'd be happy to send out, it's outdated, but I'm happy to send out, we have a toolkit for faith-based communities, but it's applicable to anybody, of any community group, and any individual, like how to approach folks, like what you can do in the community. There's a lot of, there's, like, we're called to do all of this work. Like, I know I can see these, you guys have this passion in your eyes and excitement about the work that you guys do, you're called to care for your fellow human. Sometimes our desire to help, sometimes it can have some unintended consequences. We have a lot of that situation down at the Human Services campus where people come to feed, to provide food, and because it's not a regulated safe environment, then it creates a lot of unintended consequences. So this it's outdated. I think it still says the Arizona Coalition to End Homelessness, but I'm happy to send that as long as you don't mind that old logo.
We'll ignore it.
Yeah, it'll provide some kind of like talking points about how you can walk alongside those. But again, I think that there's just this cross learning. So if there's other diversity dialogues that we can almost connect some of our membership to, I think that would be helpful. Again, we have an annual conference and trainings throughout the year. We'd love to have this kind of cross learning. I think that's communication for us. It's also good, right?
That'd be fantastic. Thank you.
Any other questions?
Oh, yes. Have you found then that just direct face-to-face contact is the best way to get people familiar with these services, or is there other methods to help the people who need this, but they don't know if there are these services out there?
It's all about relationship building. So like, like if I see the same individual at Circle K, right? Like at some point I'm gonna start engaging with that individual, start building that trust and rapport. Because if I started off with saying, hey, like you look like you're homeless, and can I connect you with a shelter, that might turn them off. Or even if I'm like, hey, here's, I don't know. And I think building that rapport helps diffuse their conversation of like, oh, well, no, I'm just gonna get the runaround. Because you're then walking alongside them saying, oh, come on, here, I got myself in my favorite clothes.
So I know Mountain Park is representing the Tempe Homes Coalition, and we do have a lot of resources in that sense and doing that. On the state level, because once we go across the freeway, we're lost. And we do have south, and so forth, but if we start going to the Arcadian, Tempe location, we get people out there. Resources are kind of lost at that point. It almost seems like there's a division between East Valley and Phoenix. Is there an effort going across these kind of, because with the Homeless Coalition, we know that communicate and educate is a big part of that process, so we know what the resources are out here. Is there an effort going across to maybe unite and educate a lot more, to communicate between the different agencies out there?
Yeah, I think that so one of the main entities that receives federal funding is the Maricopa County Health Care. It's administered or kind of overseen by the Maricopa State governments, but it's made up of nonprofit service providers, the board and committees. And there is very much a desire to have a regional approach. Execution is hard, but that is the intent. I'm going to piggyback, and I'm sorry to kind of jump down and bring up something that this is something that we fail, and we need some help with. So the Arizona Housing Coalition is the kind of main entity for the Arizona Stand Down. I don't know if anybody's familiar with that Stand Down. Oh, yeah, okay, great. So it's a outreach event for military veterans who are either homeless or having a housing instability. It happens approximately January of every year. And it's held at the Veterans Memorial Coliseum, the old madhouse on the Dell. Anyways, so it's a 2-day event for veterans. We're actually the largest stand down throughout the nation. What is missing, and we are so desperate for, is healthcare. The VA is there, but if someone were to nick their foot, we don't even have a Band-Aid. So we end up having to provide, we end up contracting with a paramedic to provide paramedic kind of emergency services right there for the event. Because again, we're how many vets came?
1,800.
Yeah, so, and then 700 volunteers, 800 service providers, all at the Coliseum. So a lot of humanity. It's organized chaos. So if you ever want to come check it out, you'll see lots of advertisements about it once we get closer. But we're missing healthcare. So if you could help us with that. I don't know what that looks like in terms of either connecting us through Mountain Park or through some of your partners. We really need help. So that would be nice. Any questions, comments? Well, thank you guys for having us. We appreciate it.